Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we have a couple of the state's leading reporters, and we're going to get into, guess what, the big stories of the week. But first, how about this? The fastest growing demographic in the state of Pennsylvania are folks who are 85 years of age and older. And we're going to talk about senior care in this state. As they say, let's get to it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, we often try to take a look at different situations regarding groups of people in our state. That's one of the things we like to do on this program. And sitting across from me is Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. They represent a lot of folks in senior care facilities, sometimes just referred to as nursing homes. You hear that? Am I right about that?
That's correct.
Yeah, nursing homes. And there is no doubt that we have an older population in this state. So the status of senior citizen residents, and when folks go out and kind of look at and take a look at where they, their elderly parents or their grandparents, where they want, it's a huge decision to make. But first, I want to start out with some specifics. The governor of the state and lawmakers are putting the final touches to the next year's fiscal budget. They have to do it by June 30. And there are lots of different organizations that have an interest in the outcome of the budget. So let's put it this way. What have you heard? What's the news about senior care in the state budget?
Thanks, Terry, and thanks again for having me. Here's what I'm hearing, and more importantly, here's who I'm hearing from. As I've traveled the state, I've heard from providers of nursing home care. I've heard from caregivers. I've heard from frontline staff. I've heard from the residents of these nursing homes, and I've heard from their families. And I hear this sense of optimism, believe it or not, this sense that maybe this year is the year, that for the first time since 2014, Governor Tom Wolf and the legislature will come together and they will make a meaningful investment in nursing home care, that they will finally adequately fund the Medicaid program for seniors in nursing homes.
So let's get this straight. So basically, you're not talking about the actual operations itself, but the maintenance of the building and all of that, but you're essentially talking about a significant program that seniors, when we're talking about Medicaid, we're talking about low income or no income seniors who are eligible for, to go into nursing homes. Is that correct?
That's exactly right. And what's interesting is Medicaid affects every facet of long-term care. So investments in staff, investments, as you said, in the buildings, in capital improvements, in technology, in incentives and wages for staff. Medicaid is the #1 payer for nursing home care. So everything that providers do is dependent on that funding.
And let's get this straight. Many of the people who are in nursing homes, not all of them, but many of them are in health situations where they cannot be, for a variety of reasons, treated in the home. Now, no one wants to kick, hey, grandparents, hey, parents, go to a nursing home. But at some point, you can't provide the care.
That's correct. And I know that your family made that decision.
Yeah.
And I've told you before that my family made that decision. And frankly, we resisted as long as we could, and we kept my grandfather.
We all do.
That's correct. We kept my grandfather at home for as long as we could, but he could not be safely cared for at home anymore.
All right, so let's talk quickly about one other issue, and that is what's going on in other states. If we have the challenges, other states must have the challenges as well.
Well, that's interesting. So it's not just a Pennsylvania issue, and we can look at other states around the country as both an example and as a warning for what could happen here in Pennsylvania. So if you look around the country and you look at states like Wisconsin, or South Dakota, or Texas, or Nebraska, or in the Northeast, Connecticut, Maine. All those states have one thing in common, and that's nursing home closures due to low Medicaid reimbursement. So again, when you're being reimbursed $8.35 an hour to care for a senior.
Yeah.
And you've cut to the bone, and you can invest in staff, and you can invest in the buildings, and you can invest in care.
Sure.
What do?
Sure.
You have to close. And I'm afraid that could happen here in Pennsylvania.
All right, we got to run to a break. When we come back, I want to talk about the current landscape of nursing and see if we can get some perspective on that, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Zach Shamberg is my guest. He's the president and CEO of the Pennsylvania Healthcare Association. We're talking about senior citizens. Obviously, their health care, their long-term concerns about how you treat them, how you deal with them. It's not easy. We love, our parents and our grandparents, but at some point, nursing home may be in the future. Well, what's going on? What's the landscape?
So I'm going to use a scary term, Terry.
A scary term.
A scary term. It's the silver tsunami.
I got that. Go ahead.
And let me tell you about the silver tsunami. So in about 3 to 5 years, the baby boomers are going to age into the demographic that is most in need of long-term care. And when I look at Pennsylvania and our long-term care continuum, we are in the perfect storm right now. And I'm going to focus on 4 storm clouds within this perfect storm. One is what we've already talked about, and that's Medicaid funding.
Medicaid funding.
The Medicaid reimbursement rate has just not kept up with rising costs. The second is the legal climate. There are very limited protections currently for long-term care providers in Pennsylvania. And we spend more than 100 million Medicaid dollars of those very limited Medicaid dollars already to defend lawsuits. The third storm cloud is the regulatory climate, and there is a focus from both Harrisburg and Washington, D.C. on regulations that focus on paperwork and not so much patient care. Mm-hmm. And finally, the last storm cloud, and possibly the most dangerous, is the workforce shortage and the workforce crisis, especially as it pertains to long-term care.
Well, the last point is true for many industries right now, with employers just begging for people who have the right kind of qualifications. So are these the sort of the fundamental obstacles that you think exist right now as far as nursing homes are? Well, what's your prognosis to deal with them? I mean, are you upbeat? Are you down? I mean, you seem like an upbeat person, so I'm not going to put words in your mouth, but I will.
And I'm trying to stay optimistic, and I appreciate that, Terry. Yeah. We wonder why there's a nursing shortage in long-term care, and when you go into a facility, why there may be low staff morale, and as we've talked about earlier, why your family and my family had such a difficult decision when we admitted a loved one into a nursing home.
Yeah.
And I look at the media in general, and I think about the stories over the last few weeks that I've seen made public as it pertains to nursing homes and long-term care. And I want to tell your viewers that when you see a negative story, or when you hear about a negative incident in a nursing home, that's not representative of the high-quality care that's provided every single day for tens of thousands of Pennsylvanians. Yeah. And frankly, folks all across the country.
Yeah, well, it's not it's a hugely difficult decision to make. And as you point out, there are a number of obstacles, and who knows if there'll be enough facilities ultimately to take care of this aging population. That's another consideration.
That's exactly right. And again, if we look at what's happening in other states, I would say to our elected officials, our lawmakers, our governor, it's time to make the investment now in this year's state budget.
Well, thanks for coming on, and come back and keep us updated on the progress, particularly with the legislature. We'll know in a couple of weeks when the legislature finally gets to the budget. All right, we have a couple of the state's leading reporters. How about this? Big stories of the week. They're coming your way.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, welcome back to the show. Joining me to discuss a whole variety of subjects are two of the state's leading reporters. Katie Meyer, she's the Capitol Bureau Chief with WITF, and Jan Murphy, she's a Capitol reporter for PennLive Patriot News. Jan Murphy, you're one of the state's leading experts on education. We were just talking about the budget. Where's it all going? Governor Wolf, it's been his single most important policy priority, am I right? Public
Absolutely.
schools, money to the public schools.
Absolutely. That's what he favors, and this week he reinforced that whenever he was asked about the legislation that's now on his desk to put $100 million into basically our private school scholarship program that we have in Pennsylvania. And he indicated, his priority is public education. And it is for the legislature as well. I think we all know that Republicans and Democrats alike always support increased funding for public education.
They may disagree about how to pay for it, but it's I'll put it this way, about as nonpartisan an issue in the state. Is that right, Katie?
I think that's fair, yeah. I mean, I think lawmakers do not want to be seen as taking away money from their district. And so schools are one of the most obvious things you can look to see, okay, is it doing well? Is it doing badly? Do we need more money? And the answer is usually yes.
Yeah. All right, now this is not a tough question. Every year we debate whether the legislature is going to get the budget done on time, whether there'll be layoffs and program curtailments. This year, it looks like, as they say, the budget, $34 billion, am I in the right range there, that the governor recommended? About an $800 million, I'll call it a surplus, more revenues collected. What are they going to get out of Dodge on time? It doesn't seem very controversial. Go ahead.
They seem to think they're going to get out of Dodge on time, but things can always change. I know they're planning for a long week next week. I have a feeling it won't be wrapped up quite then, but we'll have to see. $800 million surplus. About half of that is probably going to go towards paying. We basically overspent this fiscal year, and so we need to put some of that away. But I think there's a pretty big consensus between the Republicans and Governor Tom Wolf that we are going to put money into the rainy day fund. We have one of the smallest rainy day funds in the country. It would only
And by the way, that's a
fund
if the state gets into fiscal problems, they take the money out of the rainy day fund so they don't have to raise our taxes, right?
That's right.
Well, that's the theory, but there's not enough money in there right now to do anything. So
I got it. Well, let's go to another important subject. The governor has insisted, and it's been a major part of his budget this year. Actually, he's talked about it over the course of several years. The minimum wage. We're $7.25 an hour. That's the federal government minimum wage. All the states around us have raised their minimum wage. He wanted $12 an hour, ultimately going to $15. Is he going to get $8.50 or $9 an hour before it's finished?
I mean, that may be where it ends up. I think there's a general consensus across the Capitol that $12 starting July 1 is unrealistic. But you definitely hear some Republicans saying if he would be more reasonable with his request, if he's willing to accept something less, that there could actually be finally an increase in the state's minimum wage.
Yeah, do you agree with that?
I do. Jake Corman, who's leads the Senate,
Majority Leader.
Republican, he has been pretty open, it seems, to a minimum wage increase. Like Jan said, 12 is too high for him. But it's interesting what we're going to see coming forward, because we really don't know what that trade is going to be. Obviously, there's always a negotiation to be had. We don't know the number. Everybody's been very, very cautious about saying anything specific on it, but we do know that it's part of the discussion.
All right, we're going to run to a break. When we come back, there are a couple of important other issues that I want to get to with our journalists. We also have a certain state senator that has more than a bit of a problem, since something like 24 of his colleagues have said, goodbye, it's time for you to resign. We'll check in on that.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care.
Well, we're talking about some of the big issues before the state legislature and the governor. These are likely to become much more public and of great concern as we move towards the budget deadline on June 30. But there's also a couple of other issues that I think are pretty important, Jan Murphy. One of them is school security. I'm going to get to Senator Leach. I didn't forget about him. But let's do school. It seems to be a perennial issue, more and more concerns about the safety of our kids, given all the gun violence, and what's the latest in the legislature?
Well, I know the Senate has said that it absolutely will not accept less than $60 million in the grant program, but actually it's a total of $70 million that we put in this year's budget into school safety. Now, Governor Wolf said he's not sure that we can replicate that amount because a lot of that money came from one-time sources.
I got it.
But
so when they say school security, what are they really talking about?
Well, they're talking about giving schools the opportunity to apply for money to pay for all sorts of things, and including mental health counselors and services for students, because that seems to be one of the big areas that schools have identified.
Yeah.
I mean, there's also the metal detectors, although I don't think that's exactly popular, but securing doors.
Going through metal detectors to get into the buildings.
Yeah,
it's increasingly common.
Yeah, but changing the structure of buildings so that all eyes are on who.
There's
can
also
enter
the issue of who can have a weapon in a school. Should teachers be armed? I mean, that's another controversial issue, isn't it?
One of the ones that comes up with that is not all schools can afford a resource officer. Some of the grants might go towards that. So like an armed, basically police officer.
So hold on, resource officer would be an armed.
People use different words for it, but it's a police officer.
That's
it's an
what
armed
I mean,
cop
yeah.
in the school. And that's not uncommon necessarily, especially for bigger schools. But some can't afford that, and some, especially if they're far away from an actual police station, have a lobbied strongly to have special trainings for certain teachers and employees to be armed.
You see, she makes a critical point, and that is if you're going to have a special security officer, to be sure that they're trained properly and that you can't, given hundreds of kids that are in these schools, right?
And that's the big question. And
one of the rubs is that they say there's retired police officers in professional security services that are out there.
Right.
But the one of the regulations in the state grant program that we created last year, it didn't allow deputies and sheriff deputies and sheriffs to serve as school resource officers in another, which is, I'm told, Big Spring School District was using, and now then they found they were possibly out of compliance with the law. And then in other school districts, they contracted with the security firm, but the Department of Education said only, police officers are allowed to carry weapons in school. So they want to correct that.
All right, well, we'll see how that all works out in the budget, but I gotta ask you, Katie, about Senator Leach. He's a Montgomery County state senator. He has at least, I'll probably be wrong about this, 24 by my last count. You have lawmakers, you have the governor, you have the lieutenant governor, I could go on and on, who've said, you're out of here, resign.
Yeah.
What's the allegation? Why are they calling on him to resign?
So there's a few different things, and this goes back to late 2017. The Philly Inquirer, Angela Columbus, who comes on the show a lot, had a story that said former staffers, campaign staffers specifically, who had worked with Leach and in proximity to him, said that he was inappropriately touching people and had made inappropriate jokes, and
comments,
they described this as a pattern of problematic behavior. So Wolf called for his resignation at at the time. Of course, Leach did not resign. And here we are a couple of years later. There was basically a rape allegation, an allegation that he forced sexual activity with a person, which he vehemently denies. He's suing for defamation about that. But all of these allegations, the Senate brought in an outside law firm to look into them. That report came out in not redacted form, but in shortened form.
We don't want to use the word redaction. We'll have to go to Mueller.
Not a redaction, but basically a PowerPoint version of it came out. Leach released it himself. And it has been interpreted in very different ways by the leaders of the caucus. Exactly. Yeah. By Leach himself and the leaders of the caucus. Leach says that exonerates him. The leaders of the caucus say that it shows a pattern of troubling behavior and that he should resign. Yeah. He has refused to do so.
The pressure has been growing. I mean, almost every day, another lawmaker. You have the Auditor General of the state
Democratic Party chairwoman,
the treasurer.
You got everybody going, and
he's not going anywhere.
But he's in a pretty safe Democratic district. So if you think he's not going to resign, he might face a primary fight.
He'll certainly face a primary fight. I think at this point, Leach is seen as a political liability by the campaign committee, the Senate Democratic Campaign Committee. And so they are going to try to put up a good challenger for him. I think, as far as his caucus is concerned, he's not worth the trouble at this point.
But the bottom line, Jan Murphy, is he's not going to resign. He's going to hang in there. He's
he announced he's running for re-election.
You can disagree with him, but you can't argue at all. You can't make a counter argument that he's not a tough guy. Am I right about that? He seems impervious to the criticisms.
Well, he's certainly stayed. That's as far as I want to go in terms of my assessment of it. But and I think one of the things we should talk about with this too is the inter-caucus dynamics, because the report wasn't released because other members of his caucus thought it didn't go far enough. And this is specifically a senator named Katie Meyer. She's new. She just got in past January, and she has been calling for his resignation for a long time, and they've had, I guess, some unpleasant interactions with each other. So she wants the report to go into those interactions.
All right, we have about a minute left. Is there anything we need to look for in the next couple of weeks with the budget that potentially could derail it? Meaning the deadline, or are we pretty much on target? I don't see much.
No, this is definitely a quiet year, and I think we see that because we really haven't heard much about the budget.
Right. I was going to say, normally you all would be on here and that's all we'd be talking about. It'd be screaming headlines, right?
Yeah. One thing that I will say is voting machines. Wolf wants $15 million a year for 4 or 5 years to pay for new voting machines across the state.
We have to update the voting machines. They need what's called a verifiable paper trail.
Exactly.
And
not
that's
all of them
required.
Have that. Some of them do. But it's required under a federal settlement we got because Jill Stein sued us.
Does it get done on time, yes or no?
Probably.
What do you think? I know you're hedging. I mean, you're good reporters. You're hedging. All right, we're about out of time. Look, you're always welcome on the program. Great update. We'll have to see. I think it will. The budget, for whatever my view is worth, I think it's going to get done. They don't want to remain in Harrisburg anytime too long, but that's why we have you to keep us informed. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.